Okay, I want to say we're live. It looks like we're live now. Yes. Hey, welcome to Black Woman Medicine. I don't have an intro song yet. That's my song. That's my song.
I love it.
Welcome to the Black Woman Medicine podcast. And today we have an amazing guest before us, Dr. Jennifer Mullan. And oh my goodness, you don't even know how I'm excited to just be in the same space as you right now. I really feel like I need this. The people that I work with need this. So I appreciate you so much.
Thank you. I appreciate you, Jess. Thank you for having me. Thank you for having this podcast.
Yes,
Learning
yes,
together. Thank you.
yes. I'm going to read your bio because I just want to make sure that's really important that people know exactly. I mean, this is not even half of it. This is the one that I have, but I know that it's way more than this, but I'm just going to read what I have. So Dr. Jennifer Mullan birthed Decolonizing Therapy, a psychological evolution that weaves together political, ancestral, therapeutic, and global well-being. She is also the creator of the popular Instagram account, Decolonizing Therapy, and recipient of Essence Magazine 2020 Essential Hero Award in the category of mental health. Dr. Jennifer Mullan is the author of the book Decolonizing Therapy, Oppression, Historical Trauma, and Politicizing Your Practice. Welcome. Yes.
What a lovely intro. Thank you for having me.
Yes, we got to, because your work is so big and your rage, your sacred rage is so affirming to my heart. Like, so that's not you on the Audible, right? That's not you on the Audible talking.
No.
But
I'll comment about that in about a year and a half. Thanks.
Okay.
No, it's not. I had to audition for my own book.
I knew that wasn't your voice. I was like, that's not her voice. But it's first of all, I want to say, the first thing I want to say is the reason why I wanted to bring you on here. I've been following you for a while, actually. And I met my husband through your Instagram account. I think you reposted him or something. And so like, I kind of like, oh my God, who's this amazing nerdy man? Like,
I love this. I'm like, wait, I need to hear this story.
yeah, I'm gonna tell you about it. But I did. You reposted something of his, and then I started following him and fell in love with his content. Because probably like there's only a lot of few people that are like, well, from your book, there's a lot we just weren't taught it, that are connecting like historical, intergenerational, institutional to the personal.
Yes.
You know, there's just a few people doing that. So when I think of you, I think of Black woman medicine and how you've cultivated it. And it does, I know you've been doing it for a long time.
Thank you. I'm just receiving that, and I'm a romantic at heart. So hearing that you were like, wait, who is this person posting? I'm just like,
yeah. And it's somebody I would have never thought that, like, it started off as friends, like, and actually Soko has a little bit to do with it, because I end up going to her. She had like a healing event that I went to. And so we were like, let's just meet as friends, like kind of like how I fell in love with you watching your content. And I was a fan of his. And I was like, oh my goodness, I have to tell Dr. Jenn one day that she's the reason why we met, because I would have never followed him if I wasn't following you.
That is it's really sweet. That's really cool.
Finding your community, I've never been with somebody that cares about these issues.
Yes. It's so essential. And I think it's essential to find people that speak your language, right? So that we don't have to keep like explaining ourselves and unfurling ourselves. And
it's annoying. It's annoying.
So annoying.
I want to know, like, through listening to your book and hearing the stories that you went through just in the agencies and stuff, and the academia world. I pulled myself out of the academia world. I did a lot of adjunct teaching, but I got out of it because I just felt disposable.
Yeah.
And so like, I know you did it for a lot of years, because I'm just curious of how can you, like, how did you have the capacity to cultivate Black woman medicine with being in those type of institutions? Because I feel like it's like a constant shutdown. And sometimes it's very micro, like.
Yeah, great question. I think kind of like perhaps folks that might be in relationships that are not quite on their level. That's what I liken it to, right? But you're like pouring into it and you're like, oh, well, this part is good. And oh, but I can take this part and that's negotiable. Is it? But is it not? Right? So, first and foremost, I think it was the students. And I went to that university as an undergrad student, right? And so that university's and those programs that I was working in, because I was hired as a therapist, as a staff psychologist.
Right.
So I did group work, individual, you name it. But then also I facilitated and basically did the grants, supervised staff for a peer education program that saved my life when I was 18, 19 years old.
Yeah. Yeah.
So I had an attachment. I had an attachment to the work, and I had a lot of creativity and freedom when it came to the peer education program. Because students, we would come together every Wednesday, once a week, and we're dealing about family dynamics, historical trauma, how substance abuse shows up as a way to cope. We're talking about, I'm doing retreats on, there's not a river in Wakanda, or Denali's a river in Wakanda, and then we're doing generational trauma retreats. So I know for a fact, and they know, and people around me know, the decolonizing therapy was, like a mixture of all my experiences. And saying this doesn't work, not completely, not like the way that we're being taught it, and the way that we're being hung out to dry, and the way that us as practitioners are being gaslit. And the ways that I'm almost dying every year, literally, figuratively, spiritually,
for real,
and under-resourced, and treated as if, like kind of disposable.
Disposable. Right? Yeah. No, but like that's what like a collective of what each, like mainly the population that I'm working with right now is like is mainly Black women. I feel like I've gotten my caseload like to that.
Yeah.
My community. And that's what they say. They connect a lot of the trauma memories to disposable.
Yes.
Just like the institutions.
Yes. And I believe for me, especially in the crew and the people that have been around me, the feeling has always been like, oh, we're the problems, right? Like, we feel inadequate. We have the imposter system, syndrome.
Yeah. Resistant to treatment plan.
Right. And that's not really what it is.
That's not what it is. That's not what it is.
It's not what it is.
And you know it. And you know it in your bones. And they know it too.
You know it. Yeah.
They're just trying to play stupid.
Yeah. So really, honestly, my peer education group, we are sort of like family today. Like we're really, really tight. And I think that we broke that model as well. Right? Because, learning boundaries, redoing boundaries, also not just finishing treatment. I don't call it treatment, but for lack of a better, for everyone to understand, finishing sessions and finishing treatment, and then suddenly, well, will I ever hear from you again? Right? On both ends, like on both ends. Not that I need to go out to dinner with you every week.
Yeah. But you're part of the community. Like we're part of this fucked up community. Like, so why wouldn't we not see each other at the grocery store? That's how it used to be back in the time. Back in, you know what I mean?
Yes. We were also cared for by community, and that was something I was realizing is that I'm taking away people that I work with agency when I also don't give them the opportunity to show up for me or show up for the work in healthy, reciprocal ways that allows them to feel like a full human and not like a patient.
Exactly.
I hope that makes sense. And that was something that my team and my staff was just like, no. Like they didn't understand it. And I was like, well, I think that when you're clear with yourself and you have your own relationships outside.
It's any relationship. It's any relationship.
Exactly.
Yeah. Like this healing work follow us everywhere. It's not just in the agency.
Yeah.
So you just like had this. I guess what you're saying is when I was asking like, how did you cultivate? That's why I always think of you when I'm like, so like I did this supervision that I was invited to come on like as a guest.
Yeah.
And like from here on out, like, because I don't work in agencies anymore, you know, I can work adjacent, you know what I mean? But because of what I want to do, they're not going to let Black woman medicine in these agencies like this, like, because of what I want to do. And so, like, I've learned about Maria Yellowhorse Braveheart from actually just Googling. I didn't even learn this in grad school, actually just Googling. I was trying to connect Freud's unconsciousness to our healing right now, like indigenous healing, a historical trauma, because that's what historical trauma basically is. And Maria Yellowhorse, she takes Freud's work and basically like just like twist it in a whole, like, this is what it actually is. And I was like so excited that I found out about this. I go to all of my little healing supervision groups, and, you know, I go to these, and like people are like, oh yeah, like they just want to move on. When I'm running the supervision group, I'm running these consultation groups, but it's like they want to just move on real quickly from like historical trauma. I'm like, do you not understand that she's made this definition of like a psychological wounding over time? That's us. That's us.
That's us. And that's, yes. And what a beautiful story. Because I think to myself, I think Dr. Maria Yellowhorse Braveheart's work also for me around 20, you know, or maybe it was like 2011 or whenever I was like doing my dissertation. My dissertation was on intergenerational trauma and the soul wound, inner city African male youth, because that's predominantly who I was always serving in my internships and And I was really seeing this connection, right, between a lot of the gangs and the gang violence that they moved into and community. And now we kind of understand this, and we understand why, in particular, Black youth in the inner city may gravitate, and brown youth like gravitate towards like that kind of violence, or being in gangs, or having cliques or sets or posses or whatever you want to call it. But at the time, I felt like I was really fighting hard to have a more humanizing perspective and to like bring trauma, this definition of trauma, or post-traumatic, which we know there's nothing post about it, right? But
ongoing
into it. And at the time, I was living in California in the Bay Area. Most of the youth that I was serving in the families were either in Oakland or Bayview, Hunters Point, and San Francisco, which are predominantly like Black, more impoverished areas. And a lot of my professors were just like, Jenn, sometimes you just have to like relax. Literally, like this is what they're saying to me. Or even as I said in the book, like, you know, Jennifer, psychology and politics don't mix. You know, they just meditate more, because I went to a very Buddhist doctoral program. Very, very, very Buddhist.
Cool. Right? That's cool.
And I think it was because I was deeply seeking, and I do love some tenets of Buddhism and parts of Buddhism.
I love Buddhism.
Deeply, right? And I really started realizing that for folks with history and lineages of extreme historical trauma, right, there is an aspect of us that has to constantly detach. There is an aspect of us that cannot get attached to, not that this is true, but like energetically and emotionally, to like longevity, to relationship. Maybe in the back of our minds, there's always this sense of, well, maybe this won't work out, or maybe it'll fire me, or maybe I'll this, or maybe I'll get arrested, or maybe my boyfriend will get thrown on the hood of the car, or maybe, you know, there's always this inkling, even if we worked on it, and I'm sure you and I have, right? Like really, really processing through aspects of our history and our own personal lives, it's there, right? It's there. And so if you're a youth, you're a child or adolescent, how does that show up in who you are? How does that show up in how you engage with teachers? How does that show up in how you treat your body? And isn't it easy to attempt to annihilate, you know, someone that looks like you, a reflection of you, right? Than it is, you know, this white, you know, hierarchical, you know, energy. So I think we understand this now, but going back 10, 12, 13 years when I was starting to do this work, there was still so much resistance about the personal being political.
I think that, see, I live in Texas. That's still happening. So like, it's where I've come to it, to the, like, I basically like in order for me to do this Black woman medicine stuff, this sacred like space here, I basically had to lose a lot of friends, just a lot, because you really feel white supremacy it isolates you.
Yes, yes, it can. Yeah, and it is I think it contributes to a lot of our loneliness.
Yes.
You know,
Yes.
and definitely feelings of mistrust.
Yes.
Times.
Yes.
Right? Yeah, thank you for bringing that up, because that level of
like if you're for real about this work, you lose a lot, which in a way now I'm coming to another side of that. Yeah. I did Resma Menakem's somatic abolitionism last year.
Yeah. And yeah.
Well, in the beginning, I was crazy. And he's like, don't go quitting, don't do this, like don't go like stopping relationships, like just ease, like, because you know in the beginning of it, it's like we knew this, right, individually, but then when you get a group of people who know, it's really powerful.
Yes.
You know what I mean? It's really powerful work. And so then you realize it really shocks you again. And you're like, oh shit, the shit that's been done to my people, like Black women and our bodies, and like and fibroids and all these things that we go through, you know, in our uterus, and how it was from like, just so much violence and rape on our bodies. I was like, I'm gonna be for real. I had a hard time. But then now I'm at the point where I've let certain relationships go. Like I'm at the point where, like, if you don't love Black women, don't follow me, which has helped actually, which I've like gained more of a community that way, which is opposite like what I thought it was going to be.
Yeah, and a more authentic community, I would imagine. And I feel the same way.
Yeah.
You know, thank you for sharing that. And also, as someone who I have never birthed physical children from this body, but but I have birth.
Yes, you have.
Mother to many, but I have birth 18 fibroids. Cut like a C-section, right? Like healed for 2-3 months.
Wow.
Mother had to come out. Like it was the only surgery I've ever had, and I share that openly to say that it was one of the best things I could do, because I felt that that was on the heels of a very long-term 18-year relationship. Yeah, so there was energy there, right? And you can be Black man or a person of color and still not love Black women.
That's what I'm saying. That's why I have you on here, because just because you Black don't mean nothing. It don't mean nothing. Or just because you're a woman don't mean nothing. You still.
Yes, and just you know, as you were saying that, because I think there's something here with the fibroid piece, and you know, we're talking about historical trauma. We're talking about trauma. We're talking about youth. We're talking about loving on Black women, and where is it safe enough for our magic to unfurl? Right? Where is it safe enough? I feel like that question is like around you, if I may. Right? Like it's like that made
me tear up, and you should see my goosebumps in my arms. Like I have tears.
If I may, so like, where is it safe enough for our Black woman magic to unfurl? Because one thing is to like, ooh, pew, pew, let it out in little bursts, but to fully allow the unfurling,
has to be safe.
It's a certain kind of environment or space. And maybe what allows you to unfurl is not what allows me to unfurl. There are aspects of it, right? And so and if you had 20 of us here, that might look different and yet beautiful, like a Skittles rainbow, right? You know, that's how I imagine it. It's like, oh, you're here and I'm here. You know, we're all kind of coming together. And I suppose for me in this work, it was a reminder over and over that in order for us to feel safe enough, right, that there had to be some attachment wounding work, right, because of the historical trauma piece as well. And looking at, in particular, not that paternal doesn't, in particular, I'm finding how the maternal lineage, our maternal lineage, how much pain? Were there fibroid issues? Was there sexual assault? Was there a massive intimate partner violence? How did that show up? And how does that show up with ourselves? How does that show up in relationship, romantically, friendship wise? You know, the work we chose to do in the world.
Like, why did we choose this? Why? That's the part I always hate. I'd be like, why do I care? Why do I have values? Like, I'd have so much more money if I didn't.
No.
Why do I stand on these? It's important.
Because Black woman magic. That's why.
Exactly. Well, like, and that's a great way to put it, because that's kind of a similar way of how I look at it too, when you're talking about Black woman magic, because I think just in like Black women in general, like the magic's already there. It's there. Like you said, the issue though is like we don't have like the safetiness for it to like be able to have a space to be able to cultivate medicine. You know what I mean? It's like, because that's the tending part of what you're talking about, of that lineage of was great grandma, I just met with a client just now actually, and we were talking about one of her people in her family from like the 1900s. You know what I mean? Which is like a part of like, you know, your book and Maria Yellowhorse Braveheart helps me kind of, I don't know if it's because of my ADHD, but I have the ability to be like, oh, like, this is what's happening right now. And like, okay, then us linking it to this family member, like long time ago, you know what I mean? And then they feel it in the session, you know?
That's beautiful. That's beautiful. And really necessary, to be honest. You know, as you're talking, I'm thinking about how much resistance. Well, let me rewind. So when I talk about historical trauma, or like what I've been calling like this colonial soul wound lately, right? Like that's part of this like decolonial process, because sometimes therapists will come to me of all identities and intersections.
Oh yeah.
And like,
I know.
I'm a decolonizing therapist, and I'm like, oh, bless your spirit, but no, like, you know, like, what if we could be, and
we could be,
and we're constantly unfurling, right? And we're constantly on this journey of the decolonial process. And so have we also, what's the word I'm looking for? Have we internalized it and looked at how it shows up in our own lives? Right. And
because it's very small. That's what I learned about the Resma stuff. Right? That's why I was tripping in the beginning, because there was so many somatic responses of small stuff that'd be like, white supremacy, like just in me and everywhere. It was trippy.
It is trippy.
Yeah.
It is trippy. And so how does that play out when we're in front of somebody?
Exactly. In the session.
In our sessions, how does that historical material play out? And so this soul wound, what is the mixture of the historical trauma, and then how it gets generationally passed down, and then how it shows up present day, with a lot of us saying, I'm neurodivergent, I'm neurospicy, I have ADHD. We do and can and all that, yes. And I suppose what I'm saying is, I believe this is also this sort of evolution in the mind, body, and spirit, in the brain, this sort of shift of the DNA, which I'm going to nerd out a second. Right?
No, nerd out. That's what this is for.
Okay. This generational, this trauma transmission, epigenetic, biological, neurobiological process that has
science,
so that we could fit and deal and cope with this world. And more we're seeing youth that are diagnosed with ADHD, Asperger, and we're realizing there is such beauty and brilliance in our brains, in our neurodivergent brains, and so much sensitivity. Why would there not be?
Right.
Why would there not be deep sensitivity to the work that we're doing, to how you're carrying your children, what you're doing? So again, I'm finding that I'm asking people at trainings and workshops, and when I'm doing this work, I'm asking folks to first put like the flashlight on their own wounds, and like, let's look within first, and then we can talk about doing this work externally. And usually folks are like, but I know this.
I know. Well, that's what I'm saying. Like, that's the part that I struggle with, is because I feel like, and that's my own stuff, right? Like, it's like, I'm like, see. I don't know if you've seen the Black Lady sketch show, but have you seen that show before?
A few of them, yeah.
Yeah. And Robin Thede has this like character where she's like a teacher or a professor. She's like pre-PhD. And she's like, see, like trying to convince, like, you know what I mean? I have that. And every time I feel that pull, I'm like, Jessica, like bring it back in, because that is what's so exhausting to me.
Yes.
I'm tired of that. Like what's happening right now with Gaza, like there should be no more like, I need you to look inside. Like it's just, are we doing this or are we not? That's kind of like, I hate that that's where I'm at.
Yes.
You know, yes. But even that's just where it is. Like,
yeah. I'm with you.
And I need white people to help white people.
Yeah. Right. And that's where it really needs to start, is at home. Right. Usually when I do land, labor, ancestral acknowledgements, I tell folks that this is also me like modeling and holding sacred space and like creating space, because in the land and labor acknowledgement, what I'm often led to say by my ancestral team is something to the effect, it probably sounds better in real time, I just want to say, but something to the effect of, no, even though historically people that have come to be known as white or white people, right? Like how maybe their ancestors felt that what they were taking was going to make them rich. But little did they know that all these generations later, that really what was taken was something from inside. And that is the work that currently needs to be done now. Does that make sense? Like the rehumanization. And there are many white people out there that are on it, that are getting it, that are
absolutely
doing the work, that are humbly.
There is
space, because there are, right?
There is.
And there are folks that
and those basically like, and I mean, and I guess, you know, what I've learned is, you know, the difference between someone who really does want to do this work and who doesn't. I think I have a good discernment on that now, so that I'm not like, trying to.
And if I may, I would imagine, going back to Resma's training, I would imagine that your body tells you.
It does, because I can, like, what I learned is like, I have this like brick right here, like since I was 5, and sometimes it like softens, and then sometimes it like really hardens. And so like the program I thought was going to be like a training. What it was like a 9-month sitting with another Black woman, and like us constantly feeling the vibes, feeling the images that come up, feeling the sensations, feeling imagination, where I can imagination go. Because what the white supremacy did was take our ability to imagine. And that's why we're fighting and in war.
Yes.
Because we just think that's the only way is that we can like get things done.
Yes.
It just took our ability to imagine how to love each other, right?
Yes.
And so I'm a lot more calmer than what I was. It was like unhinged earlier though. It was like, Jessica, like my mom's like, do you have to go in there talking about white supremacy? But I'm like, white supremacy is an academic term.
Yeah.
But what I've been learning from the Zamaripas, I don't know if you know them, Dr. Manuel Zamaripa. He is, they live in Austin. Yeah.
Oh yes, they're amazing.
They're amazing. Yeah.
And his partner.
And his wife Jessica. Her name's Jessica. Yeah. They're cool. Yeah. And like they've been teaching me, like, no, Jessica, like it's re-indigenizing. Like you don't even gotta worry about that part. Like we are remembering. It's like re-indigenizing. You know what I mean? And that's helped me a lot. That's how I kind of like came up with the Black Woman Medicine thing. Is I was like, oh, this is what this actually is about. It's like if I have this space, that's my job. Is just to keep this sacred, safe, find a place of like okayness.
Yes.
Like that's it. That's my job. Like I've kind of learned like what my role is now. Because before it was unhinged. It was like took a long time.
And as you're talking, I'm thinking to myself, so much of our work, like I say in little parts in the book, Like you can skip this chapter if you're Black.
Yes.
You know, like,
Yes. I
the
love that
chapter.
part.
You don't need
Of
to
course,
know.
of course, I listened to it though, but I did it by a tree. I did it by a tree.
Yeah. Do what's good for you, or like I guess the hope, and this is why I love like the Nat Minister, right? Like Trisha Harris,
Yes.
just like just opt out, or you don't have to do it.
Right. You
You know, and
don't
I
have to.
learned that through her work. Just simply, do I need to do more? And wouldn't it be nice if part of reparations, and that's kind of how I imagine it in my mind, is as you beautifully said, is like, what if we had more time to daydream, to imagine, to be creative? I don't know about you, but when I have days kind of off, whatever that means, or like, you know, days to sort of like rest and talk to people and go outside and like not going to meeting or not, you know, that's when ideas start coming. That's when answers that I'm like, what's the answer? What do I need to do with this relay? What do I need to do with that? It starts just flowing.
Yeah, because you're in your flow.
Gripping and
that gripping is the white supremacy part. That's that colonization.
Yeah. And I think that the colonial soul, I think that what it does and kind of the flavor that I'm adding to it and what makes it a little bit different is that I have been so tired of being in the broom closet. Right? Like just tired of also not acknowledging that many of our ancestors, right? I know that mine have passed down very naturally, right? The same way you breathe, the same way you digest, or most of it digest, right? That there's just this process of perhaps knowing or understanding or seeing past what the white funnel gaze has us understand.
Absolutely.
And it's like anything, oh, that's weird, or that's witchy, or that. No, it's actually not. Like my grandmother knew things. My grandmother would ask me to open my mouth without training, air quotes, ask me to see my tongue, right? And then just be like, yeah. And just start saying, she needs this, give her this, oh, she needs more honey here. And not just like health-wise, but also, oh, she's not sleeping well. Something's bothering her. Put scissors open, metal scissors under her bed. Catholic. She's Catholic, right? But it wasn't as though that was her religion or her spiritual. It was just, this is how she knew.
Yes.
And her people were Kuna Indian.
Yes.
From Panama. Or like, so for her, it was just natural. There was just things she would pass on, and she would say to me, you know, my grandfather was the one that was very like, you know, F Americans and F this, and like, you know.
That was
like,
my grandpa too.
Yeah. Very, very revolutionary, as he should be, right? And but my grandma, it was a little quieter, and perhaps less education, just as intelligent, worked in factories, right? And her thing would be, don't forget that you know things. Like, don't forget that you get to know things. And so as I grew up, you know, I wished it away for a while. And as time went on, my knowing came in during
deeper.
My knowing came in with partners. My knowing came in, right? Like it just came in with like, I'm not quite sure about this person. Like they seem nice, but you know but
there's something, that tugging. It's like a tug.
Yeah. And at the times when I wouldn't trust myself,
you always like, dang, I was right.
Right?
Yeah.
So I like to call them, and me and another client, I talk about it in the book, would talk about the no-nos with the
no-nos.
You know, like, we don't always need to identify it. We don't always need to put it in.
We don't know where it came from, but it told us.
It told us.
It told us.
And let it keep telling us. And may we not dampen that in our youth.
Yes. Yes. Oh man, that feels.
That's Black woman magic, right? Like
that's it.
That's part of it too, right? Is this ability to say,
that's
I know
what it is.
For my bones.
And the thing about it is, what I love why I like working with people like myself is because when you spend like some time with that, it starts to cultivate. And then it's like, and then you use it as medicine. It's medicine now. Like you've made it to medicine because now you know like that sensation when that person comes. Like you just pick up on these like
Yes.
these vibes, these images that you get, you know, you just like trust it instead of, you know, because you spend some time with it. And I feel like that basically was like the 9-month program. It's like what I've learned through that program with Resma was that like, you're right. This is not just like reading a book. Like the book is necessary. I think that we need a book like yours to start. Like I feel like you pulled everything together from like all these people, Naeem Akbar, like all these people that I had to like find on my own that I didn't get to, I was not told by the professors, these people. I'm like, why am I just now hearing about Naeem Akbar like after I'm like 30 something years old last year, 2 years ago? Like that's sad, you know, but I feel like you kind of pulled it all together, you know? And so but then it has to be like swallowed, you know what I mean? And I think like when you're like, those therapists come to you and like, I'm a decolonizer, like just saying you're a decolonizing therapist is like, I don't even say that I am one because of the colonial structure that we live in. It's like the people that I work with have to sign contracts, like, really decolonial is like, just give the land back. Like the land has to be given back. You know what I mean? And so that's how you know it's like the whiteness when we're like, I'm a decolonized therapist. Like, you know what I mean? It's like, no, we're really not, but we can cultivate medicine.
Yes. And we are. And how do we work in communication? Listen, I have started doing some of my agreements or contract, whatever you want to call it, especially when I'm working with other folks, with this badass Black woman. A shout out to Brianna Nett.
Yeah, I like your all your stuff actually. I was like, I like how, because you have to put it in the business.
Thank you. Yeah. And I'm also trying to like undo. And part of what Brianna Nett has said to me, because she is a lawyer, but she's no longer practicing. And I think this is part of why. And so what she said is, we're doing an agreement, right? Like we want, like, there is something about doing an agreement together so that we can work together, and there is no, it's a spell, like it's a magical contract, right? So that there is no issue. So part of the contract is also being able to say to people, especially if you're going to work together longer term or part of your staff or team, and I'm still learning this, I just want to say that. Still unlearning this.
Girl, I let everybody go. I don't know how to do this.
It's like part of this is like talking to each other about the expectation. And I'm like, well, that might be a lot of people to talk to. And she's like, right? Because I'm imagining, and this is like, sometimes folks say to me, just like, why don't you already have this decolonizing therapy big course? Why don't you have this, certification? Why don't you? And I feel, and I spend like 2 months like, okay, yeah, I'm going to do a certification. And then I receive like, no, certify what?
Right.
What are you certifying? Right.
But that's like the whiteness part, right? We're always trying to like change it into that, you know?
Yeah. And then I realized, okay, no, I mean, my thing, what I'm really good at in this world is like holding space, like group. Like I'm horrible at 1,000,001 things, but a thing that I'm amazing at generally is holding space for people and bringing out big emotion in a safe but real
Rage doctor. Yeah.
And I've been thinking about like, what does that look like for a container? And I don't know how to get it started, but what I would love to do is be able to have, let's just say there are 20 Black women a year in the cohort, hypothetically, right? Let's just say. And wouldn't it be beautiful to be part of that, to have mandatory 3 months of your salary, 3 months sabbatical, so that somebody external
I'm going to this.
I'm going to this. Spirit. Like, this is what I want, right? Like I'm like, I don't know how. We don't know how we're gonna do this, but
we gonna do this,
right? And part of it is like,
I know how.
Okay, we could talk.
I'll tell you when we get off of here. But this is what I'm thinking. Like, okay, if we really love Black women, we gotta materially put it down. And what that in the colonial world, we're talking about money. And so you're talking about a 3-month sabbatical. Who do we get the money from? You know what I mean? Who has the most privilege? You know what I mean? the white body people that are saying that they love us.
Mm-hmm.
You got to show it. Like, you know, I have bell hooks behind me. Like, love is a practice. It's not just saying like, oh, I love Black women. Like, okay, then let's give to Dr. Jenn's funds so that we can go on this this healing journey.
Imagine that, like 3 months paid what you would be paid, or maybe more, maybe even a little high, whatever hypothetically that is for a person. And what I am holding is that it is this mix of unlearning. So sure, there'll be some education or re-education, but then there'll also be massages, and there'll also be being you safely, embodiedly, consensually stretched out.
Yes.
While you're crying. And then you're being wrapped up like a little baby burrito, and then you're on the beach and you're made juice and you're right. But
maybe some mushrooms, and I'm already seeing this.
Yes, but it's like auntie and grandma's house, right? It's not just like high end. We're talking like
really care, like in a home.
Yes.
In a home.
In a home.
Yeah. I love that. I need that, because I was like, it's that, or me and my clients joke around a lot, which I know it's not a joke, but we're like, oh, inpatient. Like we need some inpatient care for real. I'm sorry. My soul is tired.
Yeah. Yeah. I just hit it. Like I have goosebumps now. I'm just like, when you said the inpatient thing, I was just like,
that was a hard word, but I'm serious. I'm like, that's kind of where it's at for a lot of us.
Yeah. And what would it be like, instead, to do it on our terms, to be cared for? When I'm talking to some successful Black women and non-binary friends that are doing it, right? And when we have our sister friend text or quick phone calls, or like, you know, in between, like, I just got out of the shower, but how are you doing? And then I saw the text, like, not good, you know, whatever. And it's a lot for us to say that, right? Like, you know, it's not something we just throw out. Anyway, all of this to say, my friend the other night was like, I'm really in it. I'm really struggling. And there's been some deaths in their community, and there's been some other things, a breakup and some other things happening. And I thought to myself, if we don't hold in and do this for each other, it's going to be done.
It's going to be bad. Yeah.
Right? Yeah. And they were like, you know, I'm just having, like, I'm not going to do anything, but I don't really feel like being here this week. And I wish that I could just get taken care of. And I'm like, what do you need? And I know that's a hard question. Or can I do this? Can I send you this? So I sent them soup and states away, right? Like I like Ubered something, and like the least that we can do. And they were like, I'm looking forward to you just being here in like a week or two, just to hug you. And I was just like, we need physical touch that's healthy and consensual. Like
we need it. Co-regulation.
Right?
Yeah. Oh, I love you so much. Oh my goodness.
I love you so much.
I love you even more now that we've talked. Well, thank you so much. I know that we're like coming to the end of our time, but I appreciate you so much for being on here. This was so healing. Thank you. Thank you so much. Yes.
Thank you for talking about Black Girl Magic, Black Women Magic. Thank you for making space for all aspects of who we are, and for embodying your work.
Thank you so much.
Thank you.
Thank you. All right. I don't know. I'm like, how do we end this? I actually don't know. Hold on one second. Let me see.